Vaginal discharge occurs normally and regularly in most cases. Normal vaginal discharge is a healthy body function. That's how your body cleans and protects the vagina. For example, it is normal for secretions to increase with sexual arousal or ovulation. Exercise, oral contraceptive use, and emotional stress can also cause secretions. However, there are certain types of secretions that can indicate infection. Types of vaginal discharge. There are several types of vaginal discharge. These types are classified based on color and consistency. Some types of discharge are normal. Others may indicate an underlying condition that requires treatment. Type number 1. Clear, watery, or white. Clear watery secretions are completely normal. It can occur at any time of the month. It may be especially heavy after exercise. Small white secretions are normal, especially at the beginning or end of the menstrual cycle. If the secretions are clear, but rather elastic and mucus-like than watery, it indicates that you are likely ovulating. This is a normal type of discharge. However, if the discharge is accompanied by itching and has a thick consistency or appearance, like cottage cheese, it is not normal and requires treatment. This type of secretion may be a sign of yeast infection. Type number 2. Cream or white vaginal discharge. If you have a thick, clumpy white vaginal discharge, this is most likely going to be thrush, which is a fungal infection that produces white cottage cheese-like secretions in addition to burning and itching sensations. The presence of yeast fungus in the vagina is normal, but in certain situations, its growth can grow uncontrollably. The following may increase the likelihood of yeast infection: stress, diabetes, use of oral contraceptives, pregnancy, antibiotics, especially long-term use of more than 10 days, eating too much sugar or foods high in sugar directly related to bacterial vaginosis, BV, and yeast infection cause sugar changes the chemical balance in your vagina. Type number 3. Yellow or green. Yellow or green secretions are not normal, especially if it is thick, chunky, or accompanied by an unpleasant odor. This type of secretions may be a sign of infection trichomoniasis. It is caused by protozoa. Infection is usually spread through sexual contact, but can also be transmitted by sharing a towel or swimsuit. A foul-smelling yellow or green secretion occurs. Pain, inflammation, and itching are also common symptoms, but some people have no symptoms at all. It's the commonest non-viral, sexual transmitted infection in the world. More than 270 million cases of Trichomonas vaginalis occurred in 2008. The good news is that Trichomonas vaginalis is treatable. The other sexual transmitted infections that can give a yellow or green discharge are gonorrhea and chlamydia. That in women can be asymptomatic. Type number 4. Brown or bloody. Brown or blood secretions are usually normal, especially if it occurs during or immediately after the menstrual cycle. Late secretions at the end of menstruation may appear brown, not red. In addition, a small amount of blood secretions may appear between periods. This is called spotting. If incorrect bleeding occurs in the usual time of menstruation, and you have recently had sex without protection, this may be a sign of pregnancy. Spotting in the early stages of pregnancy can be a sign of miscarriage, so it is necessary to discuss with your doctor. In rare cases, brown or bloody secretions may be a sign of endometrial or cervical cancer. It can be other problems, such as fibroids and other abnormal growth. This is why it is important to get a pelvic examination and a pap smear every year. Type number 5. Grayish discharge. Characteristically, this is a common type of discharge that you get if you've got bacterial vaginosis. Bacterial vaginosis is a very common bacterial infection. In some cases, it causes an increase in vaginal discharge, which is accompanied by a strong, foul smell and sometimes a fishy smell, although it does not show symptoms. Women who have oral sex or have multiple sexual partners are at higher risk of contracting this infection. Washing inside the vagina with certain soaps, douching or using perfume products, all of these change the chemical balance of the vagina and becomes more alkaline and cause an overgrowth of a certain types of bacteria, which then gives this gray. Other causes of vaginal discharge. Pelvic inflammatory disease, PID, is an infection that is often spread through sexual contact. It occurs when bacteria spread to the vagina and other reproductive organs. It may produce heavy, foul-smelling secretions. Human papillomavirus, HPV, infection is spread through sexual contact. It can lead to cervical cancer. Although there may be no symptoms, this type of cancer can produce blood, brown or watery secretions with an unpleasant odor. When to seek medical help. If you have abnormal secretions, seek for the medical attention as soon as possible. If you have concerns about whether the secretions are normal, seek medical attention. Finally, how to keep your vagina and vulva healthy. Watch my video in 9 tips to keep your vagina and vulva healthy. Thanks for watching.